A new government report found U.S. Customs and Border Protection has not been following its own guidelines for providing medical care to migrant children in their custody. Pennsylvania Senator Bob Casey commissioned the findings from the Government Accountability Office. It followed the deaths of several children dating back to 2018. The report says immigration officials violated the law by using some emergency funds meant for medical care for other programs. For more, I want to go ahead and bring in CBS News immigration reporter Camilo Montoya Galvez. Camilo, it's good to see you after so long. Please explain to us a little bit more about what this report uncovered and how exactly did Customs and Border Protection fail to follow their own guidelines?
Sure, and it's nice to see you too, Lana. So this report by the Government Accountability Office, which is Congress' investigative arm, found that Customs and Border Protection, the main agency that detains migrants at both land borders, failed to enforce its policies that govern the medical care of migrants and children in its custody. The report did acknowledge that the agency has improved slightly in making these policies stringent enough for migrants to be safeguarded while they're in their custody, but it found several stations administered by Border Patrol did not have medical professionals on site to administer health screenings for kids and for other types of migrants. The report also found that the agency has refused to follow guidance issued by the CDC to administer flu vaccinations to kids in its custody. This is something the agency has previously said is logistically and legally difficult to implement. And lastly, the report, as you mentioned, Lana, also found that last year, after Congress allocated some funds for supplies for migrant families and children, CBP used those funds to invest in canine units, to buy printers, dirt bikes, motorcycles, and other enforcement products that were not authorized by Congress.
We also heard written testimony from the families of two of the children who died during a House committee meeting. What more can you tell our viewers about this?
Sure. So the House Homeland Security Committee, led by Democrats this term, hosted a hearing with several doctors and the DHS Inspector General about the deaths of Jacqueline Kyle McKean and Felipe Alonso Gomez, both migrant children from Guatemala who died in CBP custody in December of 2018. The doctors told Congress that these deaths could have been prevented if CBP had adequate resources, infrastructure, and medical personnel to better provide medical care to these children. Their findings were, however, challenged by the Republican lawmakers on the committee who said their suggestions, which is to improve the medical procedures and to have medical practitioners available to CBP agents is not practical. So that is still a point of contention between the two sides. CBP told us in a statement, and I want to read this to you, that it takes the role of providing care and ensuring the health, safety, and security and welfare of each adult and child in its custody very seriously, and that it is committed to improving its care and custody of adults and children. The agency noted, Lana, that last year and in 2018 they faced an unprecedented surge of families and children that made it difficult for the agency to avoid having overcrowding in its detention facilities.
Well, what more can you tell us, Camilo, about how the agency is providing medical care now inside of these detention centers, particularly given concerns about the pandemic and how it spreads?
Sure, that's a great question, but it is important to note, Lena, that Customs and Border Protection, the agency we were discussing, is actually not detaining many migrants at this point because most of them, including asylum seekers and children, are being expelled from the border under a CDC order that is designed to contain the coronavirus. So most of them are not being held anymore or processed, even if they have asylum claims. But ICE, Immigration and Customs Enforcement, which is the agency that detains people in the interior of the country, is detaining more than 22,000 immigrants, including green card holders who were accused of certain crimes. And coronavirus cases among those detainees have increased on a consistent basis since March. More than 3,400 immigrants have tested positive for coronavirus while in ICE custody so far. 3 have died after contracting the virus. And advocates are very concerned that ICE has not released some of these immigrants.
And Camilo, the Government Accountability Office offered additional recommendations. What more can you tell us about those?
Sure. So the office wants CBP to establish better oversight over how the funds allocated by Congress are administered, and it also wants CBP to establish better oversight over how officers implement these medical guidelines, especially when it comes to children. The agency also the office wants CBP to better justify why it is not following guidance by the CDC to offer flu shots. That is something that has caused a lot of concern among advocates because 2 kids died in 2018 and in 2019 from flu infections and complications from those infections. So that is a big concern among advocates.
All right, Camilo Montoya Galvez, thank you for joining us.